Hello, everybody. My name is Jeff Sych, and I'm a registered psychologist in Edmonton, Alberta. And today, what we've put together is a panel of frontline healthcare workers who are here to participate in a presentation on coping with the stress of COVID-19. It'll give a chance for the panel to ask some questions and to get some clarification or identify some of the themes that those that they work with might be having about how to get through this current pandemic. We are going to divide the slide up into different chapters and break these into about 15-minute segments. And so please select the segment that is of interest or run it from start to finish. What I'm going to ask each person to do is just introduce themselves, and then we'll go into the presentation.
Hi there, my name is Nicole Pereira. I'm a clinical nurse specialist at the PICU at the Stollery Children's Hospital.
Hi, I'm Leanne, and I am the clinical educator in emergency down in Calgary.
Hi, my name's Eric, and I'm a respiratory therapist here at the Misericordia. Currently just in a frontline worker, but in a manager role currently.
Great. Thank you for taking the time out of your day to represent the frontline healthcare workers who have really been looking for some resources and material to help them and their families get through this. And I hope that we meet this need with this video. So today we want to talk about coping with the stress that is unique to frontline healthcare workers as they respond both in their role, but also support their family, their communities through this pandemic. Today, we really have 8 topics, and stress within frontline healthcare workers is unique, and I want to identify what some of those unique aspects are, as well as what we're going through right now as a community, but also in healthcare, is pretty unprecedented in our lifetime anyway. Part of what is really important is identifying what some of the common factors are that increase people's risk to be affected by stress and go into a crisis reaction. So I want to spend some time on that. There is an effect of social isolation as well on healthcare workers. And I thought that to be warned is to be forearmed, and to be able to identify that maybe what social isolation, what the effects are known to have, so that people can counteract those. And then develop some skills for coping with stress during this time. What a lot of people are asking about is, how do we help family members of our healthcare workers or your family members understand the stress and the stress that it brings to them as they support frontline health workers, but also the impact that it has on children and teens. And then finally, how do we support people after the quarantine? Much of this research is available through different organizations, publications, Center for Disease Control in the United States, as well as some research that came out of the SARS pandemic as well. So, healthcare workers have a unique source of stress by the nature of the work that they do that is not unlike those in the public safety field that serve our communities daily. That we call this the general adaptation system, which is that for the general public, what happens is when we go to work, our baseline level of stress follows that blue middle line. And that as something happens in our workday, our body, by setting off an alarm, activates our sympathetic nervous system that allows us to resist the threat or the demand or the stress. And once that threat, demand, or stress goes down, our body resets itself at our level of stress, goes into a period of recovery to return to the baseline. But what's different about stress that our hospital-based staff and public safety personnel go through is that their alarm is going to work. that the level of stress that they need in order to be at work, in order to respond, in order to do their job, in order to stay alert, resides at that yellow line, meaning that they work their entire shift at that yellow line. And when stress or crises or critical incidents go up, what happens is that their level of response goes well beyond that yellow line. And that the goal is to help them bring down that sympathetic response back down to that functional yellow line level, not the baseline that would be similar for the general population or general public at their job, but being able to bring their stress level down to that yellow line so that they can continue working in their role and serving their communities. So that's what's unique to public safety personnel and healthcare workers is they go to work activating this resistance level, which is also known as the fight, flight, or freeze, also known as stress response, also known as anxiety. Now, what happens when our healthcare workers are exposed to critical incidents, stressful events, is that it does have the potential to affect them psychologically and put them into a state of crisis. And simply put, what happens is that largely individuals prior to a psychological crisis are thought-driven. They think that generate certain feelings or emotions. But after a crisis, what happens is the emotions take over and the ability to think is significantly reduced. So the emotions limit that person's ability to access their normal critical thinking, problem solving, calculating, being able to really function for a period of time in their role. Now, the other question that I get is, how does stress affect performance? And if a person functions well prior to a crisis or stress happening, so that's where that line where point of impact goes across to that number one, they are functioning well, they are getting through the day, they are meeting their demands. What we know is that when a crisis ensues, when there's a disruption between their thinking and their feelings, we start to see a behavioral pattern of disorganization where it's hard to function, it's hard to identify and access our normal and healthy coping strategies. And only through a series of trial and error and time do people return back up to their normal functioning, get stuck at a lower level of functioning. And for some people, there is an improved level of functioning, which we call post-traumatic growth, which we'll talk about later on in the program. So I think that we can all agree that what's really important is that our public safety personnel, healthcare workers, identify the unique aspects of stress so they can mitigate it, so that they can address it, be aware of it, in order to continue to perform their vital role. So one of the questions that I have for our panel is, what are some of the specific stresses that you're seeing in either yourself or the people around you? And I know many of you have surveyed your coworkers as to how they're affected by stress. And I'm wondering if you could just share some of the common themes that you've been made aware of.
Yeah, so like even like here at my site, like a lot of my staff and whatnot have talked about a sense of it, work being almost eerie. It's been quiet, and they're not really sure what's to come.
Yeah, I would build off of that. I think they're in this place where they know that they're in the calm before the storm, and they're worried about what's to come. And then we've started to take steps to plan for the worst. And so we're in meetings day after day after day, just talking about worst case scenario, which in itself can be quite hard on a person's psyche. But then, you start to question, are we underpreparing? Are we overpreparing? Are we underprepared or are we overprepared? Like, have we gotten to a place where we're okay, where we're feeling all right? Or is that some sort of false sense of security? For some units, there's been massive disruption. So we've tried to abandon units to free them up for other units who we think might be hit hardest. And so in that disruption, we're asking our staff to lean in and to help with the logistics, with the strategy, with the planning, and then with trying to find some new set of normal again in their practice to be able to take care of patients. Amidst, again, like we were saying, this looming threat that we see every day in the media, on every email we get, we're inundated with information, and trying to understand who is the source of truth today in this hour, because it seems to change so rapidly, and trying to keep on top of that is really hard too. And so, I mean, we don't really get the chance to shut off from the information overload that's coming at us every single day. And I'm hearing that a lot in person conversations, but then also social media, I think, is really telling as well, because people then have a platform to be able to share their thoughts and their fears and where they're at in this moment.
Yeah, I totally agree with what Nicole just said about the information inundation. And I think maybe from an emerge perspective as well, we are definitely starting to see those patients, especially in Calgary. So I find that our staff are almost exhausted just because of being in PPE all day. Every patient that comes in, we're treating as COVID positive. We're having a whole new setup for how we're managing our critical patients that are no longer in our typical areas. We're running them in isolation rooms, which just sets us up for a different cognitive overload, because we're used to running and things just on the spur. We just do things naturally, and now we have to take our staff into a different area, running these situations that are critical with limited staff to decrease contamination risk in a different area. So supplies aren't where they should be. So we're really challenging people's cognitive overload in these critical situations. So I'm finding that that's kind of created a lot of the extra stress. And one thing, Jeff, I really liked that the kind of the anxiety thing. I'm used to being an emerge nurse. I'm used to working at this level, but I'm also used to being able to go home and having my decompression strategies. And I think over the course of 27 years, done a really good job at coping with my everyday stresses. But I'm finding staff, you can't go home anymore because the news on the way home is talking about how bad it's going to get. You're getting questioned about whether we're doing the right thing, whether we have enough PPE. We aren't able to see our loved ones. And then you have people that are getting sick that you can't even go and visit because of the visitor restrictions. So I don't think we're able to have an appropriate decompression when we come home, which I think is letting us go to work ever so slightly higher every single time. So yeah, that really hit home, and you showed me that graph.
So as our panel just discussed, that there are unique aspects of stress in our healthcare workers during a pandemic, things that we couldn't have anticipated, things that we couldn't have known about, but that we are left to address. One of the things that we're hearing quite often that can be an added stress is a stigma of healthcare workers being risked outside of the workplace to their own family, and that need for self-isolation. But where do they isolate? Where do they go home to? Do they find a place that further distances themselves? And then many of you identified as well sort of that concern, not only for your own health, that what's different for a healthcare worker is that you're in a facility where you usually are dealing with other people's worst day. But I think that the virus, the risk of it affecting people that matter to you, but also yourself and your colleagues, adds in a different dimension of stress, that you are part of the community that is affected by the potential for infection, but also you are there providing the treatment for it, and that the virus doesn't know what role you're in. It treats everybody equal. I think that what is different and what we're hearing is that society doesn't necessarily do that, that society doesn't treat everybody equal, and that there is that stigma attached with what you do and the level of risk and the level of exposure, and that is putting a risk, a level of stress. Something that also came up, which is, as healthcare workers, you have a degree of knowledge that both helps you, but probably adds a level of stress as well. Within the workplace, you have that ability to control your own personal protection and to enforce rules. But oftentimes outside, we see family members, we see the public, we see people as we're grocery shopping or doing our normal routine, who really are putting themselves and maybe even themselves, ourselves, other people at risk by their choices. And that can be particularly hard with the knowledge that you have about the measures that could be taken, and when you see people that aren't either concerned for it or taking the measures, and knowing the potential risk and harm adds a level of stress. The other thing that we hear too is whether it is an actual or perceived worry about access to equipment, the right equipment, the number of respirators. When people show up at your sites, you are expected almost, it comes with the understanding that you will be able to do your job. And I think that what we're hearing is that not only does the media, but also organizationally, do you have the resources to do the job? Do you have enough face masks? Do you have enough respirators? Do you have the ability to change between patients, or do you need to conserve and reuse? And there seems to be a lot of mixed messages from media, organization, and we hear that people just don't know who to trust with the accurate information. What is really concerning is a lot of preparation for the treating of another coworker who's infected, or even the death of a coworker. We really call these line of duty injuries and line of duty death in other areas. It's something that we don't like talking about in the caring profession, but it is a real risk of, not only do we recognize that we serve the public, and not only do I realize that I could be potentially, hit with the virus, but that also my coworkers, people that I rely on, could also be impacted. They could also be at risk of death. People are drawn to healthcare because they have this want and need to do something. And really what we're hearing is the pandemic is a lot of preparation, but not necessarily being able to do anything to lower the risk right now. It's different in different communities, but it's waiting for that tidal surge to come in, that hearing that it might overwhelm the system, but being and feeling helpless and powerless to actually sort of lower that wave on your own. And the one thing that we know about public safety personnel and healthcare workers is that feeling of not being able to do anything adds a different element of stress than it might for the general population. And Nicole mentioned it in sort of what I think all three of you mentioned this, is that you guys are trained to prepare for the worst. But I think that you can't turn it off because you go home to it. You drive home with the news on, you get home to the news, you get the inundation between emails and information, both at work and on your personal machine or your personal email, your family, your friends asking all about information. And it's hard to turn off that anticipation. And what we know is that stress is caused by the unknown and predicting a negative outcome. So this anticipation of the worst is really worrying about the worst, which is directly related to increased levels of stress and anxiety. Yet it's the world that you step into and out of every day causing that stress reaction. What's unique to healthcare workers specifically is something that we call this moral dilemma. And it's really this conflict between knowing what patient care is and being able to provide it within the constraints of those things that are beyond your control. And we know that the most common influencers, and the research says that moral dilemma arises not from one factor, but when there are multiple factors. Everything from things related to the employer, regulatory bodies and the colleges that you, standards of practice that you operate under, family, patient demands, and also the smaller scale politics, but also the larger scale politics. We know everything from the difference between what might be happening in one part of our province to one part of the country to the different parts of the world. And we're inundated with this 24/7. And so this increases those risks of moral dilemma to those who are really at the front lines of these long duration, highly intense, unpredictable events. We also know that what increases moral dilemma, the risk for the inordinate stress, is when people are called upon to do things that they haven't trained for. And I think that Leanne, you brought up that just a different way of navigating your normal workplace, the normal flow of patient care, but also your use of PPE, and that it sort of disrupted what the normal flow is. And it's hard to practice and to be able to do this succinctly until you're really in it. The other thing that we hear is that people are being called upon to use skills that they haven't used in years, as if they should be able to be up and running. And that leads to the fears of the decisions that people will have to make. I think that one of the things we've heard is simply who will get a piece of equipment and who will not, who will get a bed and who will not, who stays home and who comes to emerge. And the decisions that people are being called on to make can be really that difference between the perception of life and death. And then we also know that at the front lines, the risk of moral injury is directly related to this exposure to trauma. The usual traumas that you prepare for in your training, they become sort of abnormal traumas, such as some of the isolation, the limiting of visitors, and being with a patient who is having an adverse outcome, but who can't have the comfort and care of perhaps their family around because of these restrictions. That can add to that extra element of trauma that healthcare workers experience. And then we often are hearing right now about this balance of protecting yourself, your families, versus the demand of doing the job. And we hear people conflicting about going to their job where there is that increased potential of coming in contact with the virus, perhaps even infection, and the concern about bringing it home because of their want and need to do the job. So these are some of the factors that are specific that we're hearing and that some of you have mentioned that are increasing the stress, this moral injury. So how do we cope with it? Well, I think first of all, identifying that moral injury and the risk and the factors exist, and that relating it to what's responsible for it, which are these multiple system failures rather than personal weaknesses or failures. That it is many of those factors that conspire against individuals in healthcare to increase this risk, rather than their personal weakness, their ineffectiveness, or something about their work, their ethics, their training. And what we actually know is that organizations that adequately upfront address the potential and or failures in the system prevent the cumulative effect on healthcare workers when things aren't going right, is being able to pivot, to address it, to move, to acknowledge it. But many organizations and individuals can look at either blaming or scapegoating, abdicating their role, and that can perpetuate and increase the risk of moral injury and stress. Any questions or comments about this section on moral injury?
I think, Jeff, one thing that comes up with us is having to change some of our critical practices, in the sense of when we have a cardiac arrest, we're used to jumping in, and now we're being asked to consider PPE, and we're, I think, dreading those days when decisions like that might have to be made. So yeah, I'm not sure how to prepare staff for that, other than we have to obviously figure out in the moment. So
Yeah, and I think that there's a difference between preparing for it and anticipating it. And I think that an organization that can prepare their staff for those challenges do far better than leaving their staff to anticipate it, feeling alone to meet the challenge in real time, than to know what supports are available to them prior to it happening.
And Jeff, I want to just touch on your portion about just like staff struggling with the dilemma of like having their kids at home or even their significant others, and just that increased stress of worrying about bringing it home or even getting sick. And I think it's just something that resonates with all of us.
Yeah. I think that even transmission between patients who might come for treatment, there's just that added level of vigilance that really doesn't know the limits between the work environment, the home environment, the community environment, just living as if everybody is infected and you have the potential of infecting everybody. Just, again, that unrelenting stress does have an impact.
Jeff, you talked about the sort of the overarching contributors out in the community sometimes, and I know that the political tone of the province has been affected over the last months, and we're seeing a different sort of rhetoric now that we're in the pandemic, but there's this worry, especially toward nurses, that that after the pandemic's over, what does that mean for me and my profession, especially considering, you know, what we're seeing. I don't want to get too political, but what we're seeing with the physician group over the last week. And so I think that's sort of contributing to this moral injury, is like, where do I stand? Am I important or am I not important? Am I sacrificing myself for my province and my patients who I care so much about, or should I not because I'm not valued? That's really tough.
Yeah, and I think it comes down to definition of worth. And I think what you're saying is that different levels of within the political realm seem to assign different levels of worth to the same people depending on the circumstances, which can be really, really confusing. And it can be a perfect storm when there were stressors that occurred prior to the pandemic that haven't gone away during the pandemic, and that continue to sort of be an undercurrent that that sort of this wave is now coming across and riding on top of. And you're right, that is another true sense of what's causing a lot more stress in our healthcare workers. Yeah. So now what I want to do is move on to some of the common factors that affect this crisis reaction, and remembering that the crisis reaction really is this disruption between our thinking and our feeling, where the feelings take over and our ability to think diminishes, and that our performance is impacted such that we perform only through a series of trial and error as the crisis is happening, with the hopes it will return back to our effective level of functioning. And once again, being able to look at what some of the factors are that increase this crisis reaction can help individuals identify when they've been exposed to it. And then later in our presentation, we'll talk about some practical things that you can do that if you find yourself having a crisis reaction, that can help return you back to a level of functioning. So some of the operational factors, the things that you do in your day-to-day work that increase the chances of this having a crisis reaction, that disruption, are suddenness. And when I present this to people in healthcare, especially emerge or high intense situations, they say everything we do is sudden. So I'd like you to think about this. How about something unexpected? You come to work knowing that people suddenly show up to an emerge or suddenly can change in their health status. But what if it's unexpected? Just think about the level of stress that adds. And then the intensity. The intensity really is that for some situations, what might be a normal routine event suddenly has an intensity because of some of the changes in our policies, our practices, the need to use PPE, the social distancing, the availability of maybe even patient relatives or family with them, that suddenly there's more of a demand. It seems more intense. It is more intense. We know that duration plays a huge role in the likelihood of a crisis reaction. The longer that an event goes on, the increased risk of a crisis reaction. And with this pandemic, we don't have a defined end date. But also for healthcare workers, there isn't a defined end of shift hour either. that caregiving role transfers from the job that you do professionally to the job that you do personally. And the duration of always being on, always somebody needing something can also increase that reaction, that stress. The level of loss can be defined by that this just doesn't affect one small community, one small facility. It literally is enveloping the world. It affects communities at different rates, but there isn't a place to escape it. And that the level of loss, as we see numbers in media of the infection rates and the death rates posted every day, that level of loss is hard to escape. It's hard to turn off. And then age as well. I think that commonly we know anything involving kids, children is far harder on healthcare, frontline healthcare workers, but we also know that it's any age that you relate to. So imagine for a moment that you're providing care to somebody that reminds you of maybe your parents, maybe grandparents, something that gets personal, an age that you personally relate to can also increase that crisis reaction, the risk of that. In a pandemic, well, guess what? Unlike your regular duties, the risk of injury or death to your relatives, friends, co-workers is substantially higher. And then we talked earlier about this availability of resources, everything from PPE to the number of ventilators to the bed to swabs. The focus on resources right now is constant, and it's really inconsistent with what the messaging is, where the resources are they available, what level are we able to attain, and so there are conflicting messages. With regards to level of education and training, well, first of all, I'm not sure that many people can say that they have much education or firsthand training in this, meaning delivering frontline care during a pandemic where it's intense, it's long duration, and that this is really new. Nobody can really, we can be educated about it, but we don't necessarily have experience with it. And so these level of education and training can also increase that likelihood. And then, as I said, stepping out of that door of your workplace into your personal world is harder and harder to do because you're coping with the stress of perhaps loved ones, job losses, changes in the economy, kids being home from school, and you go from being healthcare worker to teacher now, or enforcer of the rules, and that there really is just no time to turn off between shifts. So people are coming to work already feeling exhausted, feeling like they're not coping because there is no time to take for themselves. So those are some of the most common risk factors in addition to what we just described, which were those moral injuries too. Now, organizational stress factors, there's been some research in not only what we do, but the community that we do it within, the organization. And so the workplace influences our psychological well-being. And we know that at times where there are pandemics and large-scale events, disasters, that these organizational stressors, they're not necessarily imposed upon us. They're really a consequence of what's going on around us. But if the organization hasn't addressed it or doesn't recognize it or doesn't take some steps to mitigate it, it can actually in itself be a contributor to a psychological injury and stress. So everything from heavy workload, conflicting roles, these time pressures, and a lack of resources and controls and social supports. Most people are social distancing, social isolating, that we're not able to connect to those staff events, those team events, those coming together in a way that is normal. And so we can feel more disconnected even from our supports in the workplace. I know that in some situations, supervisors are actually working from a distance. They're not on site. And so it can feel like there's a lack of support, that there's a lack of understanding as to what it's like to be at the front lines. And this can be also a lack of feedback, a give and take, a back and forth, the ability to share concerns or to get feedback as to how things are going can be part of the operational stressors. And at this time, major decisions are being made on a larger scale, higher up in the food chain, where there can be a perceived lack of participation in these decision making. You're frontline, and maybe there's a perception that we're not being asked what we need to do our job, that there's a feeling that people aren't taking that into account. There's just the expectation that we should show up and do it. We know that any job that requires the emotional empathy can really take a toll, that in the routine job, part of your role is to have that emotional empathy for the people that you work with and care for. That can also take a large toll. And then this lack of sufficient rewards. And for most people, it's interesting when they looked at what people wanted from their organization. The first two say monetary and social, belonging to a larger sense of community, being a healthcare, being a nurse, a respiratory therapist, whatever it is, has some degree of I feel good about belonging to that profession. How I get paid, we should all get paid for the work that we do. But most impactful is this intrinsic sense that what you're doing has value. That most people will say of all the three types of rewards, the lack of intrinsic reward, feeling like it is all for naught, feeling like there is no benefit coming from it, is one of the largest stressors that people report, even more so than money or that sort of social aspect. There was a more recent study that sort of distilled these down into, in Canada, what are some of the organizational factors and stressors today that seem to cause the largest degree of stress in our frontline workers? And that includes inconsistent leadership, bureaucratic red tape, dealing with coworkers, feeling like different rules apply for different people, and feeling like you're always having to prove yourself to the organization. Has sort of been added to that list as sort of society changes and demands change, that these now come in addition to those other organizational stressors that we just talked about. So any questions or comments about organizational stressors, operational stressors, and how they impact frontline healthcare workers?
I think from my standpoint, we work for a very large organization, and so sometimes we get information from outside and we're still waiting for the organization to give us the direction. And I know from a leadership aspect, I want to give staff the best information possible, but it really has to be, I need to have direction from HS. And so sometimes it's waiting. And so staff can get frustrated because sometimes the larger organization does take a little bit longer to get information out than the media is already down our throats about something. So it's really about, let's make sure we have best practice. We want to have best practice, and being able to kind of hopefully be a couple steps ahead of things, so staff aren't getting frustrated because they need information now, and sometimes there is a delay because of the infrastructure that we work in. And eventually the results are excellent and we have best practice being promoted, but staff are, I think, needing it before it's able to come out in a official document sometimes. So
yeah, we again are really familiar with the aspect of that flow of information. And to find out from an external source what's expected of you at your job that hasn't been communicated internally can absolutely add that stress. And that getting and giving different opinions inside and outside the organization and the communication of it. The other thing, as a healthcare professional, you're bound by confidentiality, but also sort of standards and practice, where it's really hard when you hear inaccurate information to stand up against it. And for a lot of people in healthcare, it's a feeling of that if things are said that aren't accurate, there's no way to stand up and change the public perception and make it more accurate. And those are some of those added levels of those organizational and communication aspects that we routinely hear about as sort of tipping people over the edge, to really that they could cope with everything except when they go home and hear inaccurate information that they feel powerless and helpless to counteract.
Just to add to that, even within our organization, when we land on a final, there's another group that doesn't quite agree yet. And so like it's been so, speaking from my perspective, for the last 4 weeks, the conversations have been so cyclical because it's so difficult to make massive decisions that we are being asked to make and that we need to make with such little tangible information, very little research in certain fields, and we're being asked to make these massive decisions. And so of course we're going to have different pockets who believe in different practices, and so that's been a massive challenge. And then Jeff, just to speak to something else that you were talking about is, I don't like to reinforce stereotypes, but as a frontline worker, you often have a sphere of control that is your patient family, your unit. And I think one of my friends, when I was asking her this question today, just before the webinar started, she shared with me a statement that really resonated with her, that she had heard from someone else, that the illusion of control that she felt that she had has been removed. And so it's not a easy place to be when you feel so out of control of so many things in your personal, professional life.
Yeah, and I think that going back to the beginning, being able to say you don't just step out of your work environment into sort of an organized, controlled world. You step out of one type of chaos into another form of chaos. How we buy our groceries, how we teach our kids, how we walk on a sidewalk, all of these things have been disrupted. So people keep talking about a new norm. And I think that there is no such thing as a new norm. It really is adapting, because that norm is constantly changing. How we pay for our groceries, how we walk up and down the aisles, simple things like that, we now have to think about. And it's hard enough to do our job and think about those technical aspects of patient care and our professional conduct, to then leave there. And these routine things that we normally do that give us a sense of comfort are so disrupted as well.
And Jeff, when I was walking through even ICU and Emerge, and just even in my own RT department, I was just thinking about all the different healthcare professions that are involved in this COVID-19 response, and the increased responsibility that everybody has to take on. What was interesting was even a physiotherapist on the floors might have to start doing some of my roles as an RT, or even healthcare aides having to take on increased responsibilities, or even the unit clerks or LPNs, RNs, all the health professions having to take on way more than what they're normally used to, and it's out of their comfort zone.
Yeah, really taking on those roles that people weren't trained with or trained for, that they might even be outside their scope of practice on their normal assignments, but now it's stepping up and taking on those roles. And I think that there's a degree of professionalism and wanting to do right, and knowing that the consequences in healthcare of doing something wrong are grave, that people want to do the best, but not necessarily having a reassurance that they have the confidence in knowing what they're doing and what their normal confidence level is, that says that they are going to make that positive difference rather than an error, a mistake, or have an adverse outcome. Yeah, it's a huge stressor right now that we're hearing.
Actually, I just wanted to comment one more on what Nicole had commented about us living in our patients and our own departments. We've really had to expand our viewpoint, because especially with Emerge, we connect with every department, and you don't think how even afraid that the porter is. I normally just pass my patient to a porter, they take them someplace for me, but they also have their own fears and anxieties about what it means for them to be transporting. So we've had to really collaborate with every department throughout our entire hospital to make sure that we're all on the same page, that we're all making sure that everybody feels safe, and that we're all making sure we're passing on the same information. So it's been a huge, from an organizational perspective, a huge workload just to get everybody on the same board. So yeah, it's been interesting.
And I think that it's being able to sort of say it's a ripple effect of impact, that suddenly we have people who do a job that is being pretty routine, such as a porter, who suddenly has to become almost an expert in their own sort of safety and virus transmission and donning of PPE and all those different things, which again, they may not even have gone to the job thinking that they would ever be required to do this or exposed to it, and it's pushing their personal limits.
Mhm.
I think also this is a vulnerable population that when they go home to perhaps their family that doesn't necessarily understand, we're starting to see even more and more of that sort of stigma and that isolation and seeing people as a risk and people really misunderstanding. And so it just really is that snowball effect.
Mhm.
So what I want to do now is talk a little bit about the effects of social isolation. Fortunately or unfortunately, we have some experience and knowledge from previous outbreaks as to the effect that isolating oneself has, both short-term and long-term. And out of the SARS pandemic research, what we've actually been able to come to understand is that social isolation does have a serious and lasting effect on the mental health of healthcare workers. And what we have found out in the research is that social isolation is highly correlated and predictive of the development of some psychological disorders, including acute stress disorder, increased levels of depression, and coping, numbing themselves using alcohol. But what we also know is that 3 years later, the research says that individuals that were quarantined, socially isolated, were at higher risk of developing post-traumatic stress symptoms. That these avoidant behaviors also prevented a large number of people from returning back to their role professionally, and many of them stepped away from their patient care role as well. And in an overtaxed, highly utilized, very stressful, often short of the most important resource, which is the personnel, I think that taking measures to limit the loss of our frontline workers, we need to address that sometimes what we are asking them to do, insinuating what they should do or forcing them to do with this social isolation and quarantine, is going to have an impact on their ability to come back and return back to their normal job once the pandemic is over. And so that's come out of the SARS research, that 3 years later, that ripple effect is still there. So for those people that think that, in a month or two, things will return to normal, what we do know is for a number of people, 3 years later, things continue to be very abnormal, that they're having a normal reaction to what is really an abnormal blip in the world. And so understanding this, again, helps us understand the importance of creating as much as we can using novel and unique ways to connect with each other, to limit that sense of isolation, and to support each other and come together in the community that you work. So what are some of the coping strategies for the hospital-based frontline healthcare worker during COVID-19? Well, it's recognizing that not only what we've talked about is this is a very stressful experience, but it can also be very rewarding. I think that we see that with regards to communities acknowledging the impact of frontline healthcare workers, that there is an appreciation, and that can sometimes get lost, forgotten, not acknowledged, and that all we focus on is the stress, the negative aspect. But one way to cope with it is find something each day that has a rewarding aspect of the stressful time that you went through. Another way to coping with the stress is that recognizing that this fear, this anxiety, and again, fear and anxiety are an anticipation of the future. It's actually expected. It's something that's unavoidable. So if we expect ourselves to have this increased level of anticipation that causes us to worry and have fear and have anxiety, then we don't become anxious about feeling anxious or fearful of living in fear. But what we've really learned is managing stress is essential during a pandemic to large scale long duration events. And that what we do know is that there are effective coping strategies that can be used both before, during, and after a pandemic. And for those that we work with in a healthcare setting, we actually call this pre-incident education, teaching people the unique stresses associated with their job, anticipating the stress will occur, and teaching people what they need to do to recognize the signs and symptoms, what they can do to mitigate the stress reaction, and then what they can do after the stress is over to continue their health. So we know that coping with the stress really is about three words. It's about building your resistance, it's about developing your resiliency, and it's about being able to plan your recovery. So what do? Well, we really want to deploy these preventative measures. So I would ask each person watching this to do an inventory of how do you know that stress shows up in your body and in your life? How does your body tell you that it's not coping well with the stress? And then what do? What have you done in the past that's worked to reduce the stress? And do them. Maybe you can't do it to the same degree that you once did when maybe the gym was open, or when it was free to walk in a crowd, or maybe go out for dinner with friends or visit family, but adapt it to work, be innovative, be pragmatic. We know that there's a large body of research on grounding techniques, being able to just breathe, being able to just sort of feel the moment without anticipating the future. We call that mindfulness. There's a lot of different resources and apps that people can use to practice and learn mindfulness. But what we also know is that education, learning about stress, learning about yourself, learning about that it's okay to not be okay, and that you're having a normal reaction to what is an abnormal situation, can often do a lot to help reduce that stress. So educate yourself. And in the moment, it's really knowing, what do I need? Are there places that I can call? Are there people that I can talk to? Are there peers that will understand? And if I need more, where do I go to get more, whether it be formal counseling or formal treatment? But it's knowing prior to the impact where you would feel comfortable going, or what is accessible to you. And for everybody that works in a healthcare setting, there are some supports and services, everything from your employee and assistance, your EAP, your employee assistance program, to many organizations have peer support and crisis intervention on site or available. And then also, do you have any resources that if you need more, that you can access for maybe counseling or more formal treatment? Family doctors, community treatment centers, family, friends, people that you trust might be able to give you some guidance as to where you can access some supports and services. So here's some things to remember during this time of responding to the threat of COVID-19. We want to acknowledge that what is going on is having an impact, and we want to be able to understand the nature of that impact, not only on ourselves, but those around us. If we want to say, this isn't impacting me, it hasn't changed me or those around me, there might be sort of a disconnect between your experience and the reality. So acknowledging as a first step the nature and magnitude that this pandemic is having on you and those around you. Just doing that bit of an inventory. Be prepared to be impacted not only in your professional role, but in your personal life as well. Don't let it sneak up on you and be surprised by it. Again, just reflect back on, say, how is this changing what I do, how I do it, both professionally and personally? And then we know that stress actually affects us in 5 really predictable areas. So first of all, there's physical signs that stress is impacting us. It might be from everything from increased blood pressure, muscle tone, or muscle aches, headaches, upset stomach. From an emotional point of view as well, Most commonly, maybe our fuse is shorter, maybe we're more tearful, maybe more feelings of guilt or sadness. From a cognitive level, it changes the way we think. It's harder to plan, it's harder to think, calculate, problem solve, really make sense of things at times. And then what happens is we start to see behaviors change to cope, where maybe what we do is we might increase our sort of physical exercise, or maybe what we do is increase our numbing, our zoning out. Maybe that's the use of alcohol, medications, internet, zoning out in front of the 24-hour news cycle. But what we do in response behaviorally is really going to impact whether or not those other signs and symptoms of stress go up or go down. So it's being able to make sure that what you do is adaptive and healthy for you. We also want to encourage people in healthcare. I know it's often hard when there's a job left undone, when there's patients yet to be seen, when there are people suffering or in need. It is hard to put your needs ahead of theirs. But remember that a sprinter that runs a marathon often doesn't complete the run. But a marathon that runs a sprint also has a difficult time too. So we want to make sure that our healthcare workers take time to respond to their needs and the needs of their family, as well as those needs of patients in the organization that they work for. And it might be a good time before you recognize or even are significantly impacted to make a list of the personal care activities that you enjoy. So all you need to do is find that sticker on the fridge or on the mirror, rather than trying to recreate or think about what you would normally do to engage in self-care. We know that being active, just getting your body in motion for about 25 minutes can burn off the stress. We know that distracting with a book or some sort of distraction with a movie can really be helpful to just turn off the mind. And we are social animals. And what I said before was that social isolation has such a dramatic and negative effect on us, because we really are creatures of being together in a social setting and staying connected. That it's important that best we can to ensure that we don't break those connections, that we keep them going. And what we want to do also is take a break from the media coverage, including social media. Our brain really has this habit of, every time it sees a news story, it thinks of it as a unique and novel event. Whether you're watching repetitive news cycles on TV or reading social media, that your brain can't distinguish between one event and the repetition of the same event, and it becomes cumulative. So if you're reading 5 news stories on the same event, your brain thinks of that as being 5 distinct events, and it can have that cumulative effect on you. So take a break from the news coverage, take a break from social media. You're not going to miss anything that you can't pick up when you're ready to check in for a limited amount of time. And most importantly, if you're feeling overwhelmed, ask for help. Go to your go-tos, go to your supports. It's not a failure. After all, in healthcare, when people show up asking for your aid as a professional, you don't think that they're weak. So if you're asking for help, nobody's going to think that you're weak. They're going to acknowledge that you're having a normal reaction to this abnormal situation, and that feeling overwhelmed is to be expected, not to be avoided. So we are in this for the long haul. How do you do that? Train hard, know your job. Make sure that you routinely participate in getting your body used to those changes in how you perform, those simulations. So practice your skills. Do those things that don't come routinely over and over again, so they become a little bit more routine. And for those of you that work in a situation where you might need to self-isolate due to exposure, make sure that you have a to-go kit. Make sure that you have something that has at least enough to carry you through until people can bring you more. So we encourage people to have a to-go kit that allows them to, if overtime is needed, to be able to stay, but have what they need to get through. If you do need to isolate, that you're not left without what you need. And if you're called to other departments or units for relief, you have that ability to sort of refresh yourself, look after your basic needs in order to meet those demands. We know that reviewing policies and SOPs is a good thing, but not obsessively reviewing them and over inundating yourself. Get updates as things change daily, but limit that sort of constant flow of information from the minute to the hour to hour. Not much changes in a couple of minutes or couple of hours. We encourage people to check at routine times when it's convenient for them and update yourself daily. Make sure that you take that time, that ability to sort of slow down, clear thinking, be prepared. That will make you a valuable team member and decrease your risk of harm. And remember that to be disaster ready means keeping in good physical shape, eating healthy, and practice emotional grounding. I said to you before, those that recognize their personal signs of stress and what's causing their stress can often react to it and reduce it far quicker than trying to figure it out in the middle of it. Create a buddy system, somebody that you know, maybe somebody that you both know each other that can recognize the signs and symptoms and encourage you to get exercise, relax, or even talk. And take time to disengage from those operations. What you need to do is work. It's important that you take time away and do those other things. Find constructive ways to relieve your stress. If the gym isn't open and you're normally an active person, find an app, go for a walk your stairs in your house, do something. And do activities that you can do safely alone, such as taking deep breaths, reading, listening to music, going for a walk, stretching, meditating. Keep it simple. Just a few minutes a day can make a huge difference. And here's what we do know, that 22 minutes of your body in an active cycle can help you get more restorative sleep than if you just go to sleep stressed. So here are some of the common signs that stress may not be managed effectively. So sadness and empathy, guilt or shame, shortened fuse, blaming yourself or others, and just a sense of being irritable. The alternate is sort of this emotional numbness or indifferent, almost like you can't care anymore and you have to shut it off, like the emotional breaker. That you're not really paying attention to your self-care because you're so focused on everybody else, and that you just can't get enough rest where you can wake up feeling refreshed. There's constantly feeling tired, exhausted, overwhelmed, maybe even feeling like you're a failure or helpless or that you're not performing. And then you start to sort of rely on things to sort of shut off, numb, or to cope, like drinking more than you normally would, or taking something to numb yourself. This excessive worrying, that fear that something bad is going to happen is sort of a good indicator that you're signs of a psychological impact. That if you're easily startled or on guard, if you have a racing heart, recurrent thoughts or nightmares, or really focusing on other people's difficult or traumatic situations as if they're your own, those might be signs that you're impacted, and increasing the self-care, reaching out to your resources would be indicated. And as much as we are socially distancing, we still come in contact with people, and stress and psychological impact impacts our interpersonal relationships. So we see irritability, anger, hostility, this need to blame, this decreased ability to support our team members, more conflict with peers or family, this sense of withdrawal, and this increased sense of isolation from our family, our coworkers, are also important signs to recognize. So what are some of the self-care techniques? It's okay to set your limits. Know what's healthy for overtime and extra duties. Be okay with saying no at times. Doesn't mean you'll say no every time. And work in teams. limit the amount that you work alone. Just keeping track of what your thoughts are, what your impacts are, by maybe putting down a few words in a piece of paper. And most importantly, talk, access your friends, your family, supervisors, your other team members who are also impacted. After all, those are in it with you, understand it from a different perspective, and more likely to help you through it. Breathing, relaxing, maintaining a healthy diet, sleep and exercise are important, and setting really good, healthy boundaries, being able to say no. And most importantly, be okay with not being okay at times, and avoid the attitude of suck it up and to do more. So especially for healthcare, especially for frontline workers, it's important that it is not selfish to take a break, that the general public needs are not more important than your own needs and well-being. And working all the time does not mean you will make your best contribution. There's other people who can help. Let them. Knowing and recognizing the signs of stress in yourself and others will help you cope more effectively and help those who are also affected. So when to seek help? Well, what we've talked about are some normal reactions. That usually engaging in some self-care is enough to help bring those reactions down and return back to a level of functioning. But on this slide here, we have some of the reactions that we would really encourage that if you are experiencing them or seeing them in other people, that they do require more professional attention. Sense of disorientation, prolonged and intense sadness, thoughts of hurting yourself or others, this unrelenting anxiety just never goes away, this constant fear of waiting for the other shoe to drop or that something bad's going to happen. And these unusual perceptions, these acute symptoms of hearing voices, seeing things, or delusional thinking, the inability to care for oneself. And that if you just notice that your use of drugs, alcohol, or prescription medication are just not your norm, they're beyond your baseline, those are indications that you might want to reach out for some professional help. And anything else that is either impulsive or uncharacteristic for you, talk to somebody. These are signs that stress might be overwhelming you, and that with some professional attention, you can really quickly return back to your level of functioning. We've talked about the negative aspects of stress, and I don't want to leave this section until we talk about the signs of positive stress, positive change, post-traumatic growth. Through difficult times, we can grow. Most of us do. And some of the things that we might have taken for granted, we might be actually more appreciative now. That we have become more understanding and tolerant. Things that might have annoyed us are less bothersome. And that we might appreciate the relationships that we have, the staying connected, now that those connections have been disrupted. And maybe there's a sense of gratitude or being grateful for what we have, or this improved perspective. Maybe what happens is as we go through difficult times, our connection to others and the greater good has a sort of feel, a renewed sense of sort of greater connection. Whether you call that spirituality, existential, it doesn't matter, but it's a feeling that we are something larger than just ourselves and that we're interconnected. Those are signs of positive growth, and most people experience them. So any questions or comments on this section that we just presented on?
Jeff, the one question I have is when I'm looking at this for myself and kind of monitoring my own self, but is there any good techniques for monitoring our colleagues? In the work environment, everybody has different coping strategies, different life experience outside of work. Is there anything that we can look at for some things that maybe we need to reach out to some of our colleagues to get some help during this?
Yeah, I think first of all, I think it's creating a culture and an atmosphere that if you're offering help, that you're also willing to receive the help. So I think it's that not having a double standard, first of all. It has to be safe for people to acknowledge their impact. So it's creating that sense of safety that it's okay to say, I'm not okay. And then most importantly, and this is where your peers, the people that you work with are really, and the people that you live with by that matter, really understand what your baseline is. And it's being able to have a caring conversation when there is a change from your coworker's baseline and doing it in a constructive way rather than a critical way. Being able to start the question or start the conversation with, I just notice that you're not yourself. And then being able to identify, do you know what to do about it? Do you have the supports? Do you need something more in a caring way? And it's interesting that being in a caring profession, sometimes the people that we ignore the most are the people that are standing next to us in the roles that we do. So I would say extend that caring to those that you work with in that neutral, non-judgmental, helpful, constructive way that you would with a patient. I think that also being able to give people, and I know that on some of the different hospital-based teams, we don't want to anticipate that people are going to struggle, but what we want to do is acknowledge that people will struggle and that that's okay. And I go back to my favorite saying, which is letting people know that it's okay to not be okay, that it's not a personal weakness, and that you're willing to have the conversation. Any other questions or comments?
Yeah, Jeff, I think even for myself, like when you, like, as you did that part of the presentation, it was really good reminders even for just myself, thinking about like my own stresses that I have in my new position and whatnot, and thinking about taking that time to make sure that I set that time in my calendar to like exercise, if that's like what I do to de-stress if I had a really bad day. And I think that's really important even when I think about like my staff that I look after now, just making sure that like they're getting their breaks. If they're not, like maybe those are things that even I have to look out for them to make sure that we give them that chance just to step back a bit.
Yeah, recognizing, we often say that the best place to start in supporting people is recognizing their basic needs, the need for a biological break, either to put nutrition in or to go to the bathroom, to be able to step away and let people know that it's okay to step away so that they can step back into it. So I like to sort of say meet basic needs as a place that you can start in the workplace. If you notice that somebody hasn't had a chance to take a break, recognize that. Even if you can't cover them to give them a break, sometimes just that acknowledgement is enough to help them say, well, somebody's paying attention and notices that it's a stressful time or a long duration. We know that social support really plays a role, and it doesn't necessarily mean that we need to help somebody through a stressful time. Sometimes all it means is that there is an acknowledgement that there is a stress going on, even if there isn't anything that we can do about it. And that way we can feel one with the experience rather than alone in the experience. And that has a huge restorative and protective factor.
And even Jeff, when you're talking about even like duration, like I think about even how COVID-19 has affected how we even like run code scenarios and whatnot. Like they're trying to limit the number of people that are in there. So it might just be like one physician, one nurse, one RT. And like those people are in there taking care of that patient versus somebody else might be on the outside helping, and their involvement is a lot more than and not being able to like say get that help, somebody switching quickly. Like we want to decrease the risk of exposure of the numbers of healthcare workers that are in that room.
I agree, and I think just acknowledging that it's an imperfect situation right now, that you're all in together, whether you're in the room or outside the room, in itself is a form of support.
I'm going to jump right to that growth part of the section here. It's been really cool to see how fast we've been able to push through certain innovations that have been on our back burner for a very long time. So I won't get into specifics, but I will say that I'm really happy, and it's energizing to see some of the gains that we can see and hope that we will continue to see through this pandemic. And then another win, I guess, is, as Leanne was saying, instead of your scope of control being at the patient family unit level, we have had to, bridge the silos and talk to various different units and departments. And with the potential for redeployment, we're really working on strategies to be able to build relationships between management, build trust between management. This idea that we're not just looking out for our own units, we're looking out for the site as a whole. And then to start having that filter down to staff relationships. And so what does that look like when we're facilitating shadow shifts or buddy shifts, and making sure that the expectation is clear, and that we're offering tools for communication so that we're setting up these relationships for patient care in a way that's successful for everyone. And so there's some really cool potential with what we're doing in that realm of things.
And I think that, again, that post-traumatic growth it's finding the silver lining in the gray cloud. It's really looking for some of the positive. Stress has this aspect on all of us that tends to have us focus on the negative. It's called the negative brain bias. And that when stressful times go up, we perceive there to be a threat. So we look to confirm that, which is usually the negativity. And sometimes the most constructive things we can do is ask ourselves, how might there be a positive out of this? How might this adverse situation that we're going through have a positive effect? And it doesn't have to be big wins. It can just be little ones, because again, the negative brain bias skews your brain to perceive things more negatively than they are. And to bring balance back simply says to find something small so that it sort of tips that scale back to be more accurate. As difficult as the situation is that we're all going through, it is worldwide. The other thing is there are positive things that the changes in how we function are having on some people, and the negative as well. So balanced thinking is key during this time. Really, really fight that urge to focus on that negative and feed into that negative brain bias. Some of the people that I work with that are really struggling with the negativity, I ask them to write down 3 things that they're either grateful for or that were positive from the day before they go to sleep. Now, after a couple of days, what they say, it's harder and harder. And they say, so I had to create them. So I wanted to write 3 things down, so I made sure that I caused them to happen. And everybody has that power that within the challenges of the day, they do have that ability to make one small positive thing, a medium positive thing, or sometimes even a large positive thing happen. So we can control certain things, even in a world that seems out of control. We can control what positivity we bring to it, either in our actions and our thinking. And it really has helped a lot of people get through what is perceived as being an overwhelmingly negative time. So we've been asked a lot for information on addressing family members of healthcare workers during COVID-19 and the stress, as well as for children and teens. And so in the next 2 sections, we're going to talk about that. So first of all, how do families support healthcare workers as they come home from the stress of their work, from what they've been exposed to, and how do they encourage them without adding stress by either nagging or taking over control to increase their self-care? Well, I think that there's a lot of things that family can do, which is, as we said, if you leave the workplace, which is stressful, to only go into another stressful environment, that is just going to sort of keep that stress fire burning. So family members can do certain things by not necessarily taking away all of the responsibilities of the frontline healthcare workers, but helping them balance with, most importantly, allowing them to get proper rest, especially with shifts, especially with overtime, call-ins, those sorts of things. They're recognizing that the basis of good physical and psychological health is rest and sleep. It's being able to encourage and remind our healthcare workers to engage in a healthy diet, get regular activity, even if it's just walking, and to relax and spend time with family and friends, and to turn off the pagers, the apps, the all the different social media, and stay healthy and look after yourself, including that if you need medical care, to also seek it. That sometimes family members can sort of take over some of those extra routines that are being disrupted, paying bills, mowing the lawn, shoveling snow, shopping for groceries, recognizing that if we go back to in the very first section, that level of arousal that our healthcare workers need to engage in order to their job is significantly higher than other people doing other jobs. So healthcare workers are burning more energy during the day. And so therefore they may have less energy to do some of those routine tasks. And it's just acknowledging and recognizing them. And it also says that don't expect healthcare workers to come and talk about the experience. But if you do want to engage in a conversation, it can often be better to talk about sharing how their experience has impacted them rather than focusing on the experiences. There's always a tendency to want to talk about what happened, but we actually know that one of the most supportive ways that we can offer that support to others is to talk about how their experiences impacted them as a focus. So again, we know that children and teens at home have a different response to stress. Not all children and teens respond the same way, but here's some of the common changes for you to look. Here's some of the common changes to look at. So in children and teens, maybe there's excessive crying or irritation. Younger children are more irritable. That maybe there is a regression or return to behaviors that they've outgrown. Maybe there is this pervasive sort of worrying or sadness or needing reassurance from their parents or caregivers. That with the disruption to their routine, their schooling, disruptions to your routine, the world, that there might be sort of this unhealthy eating habits or maybe changes in sleep. And in teens, we see irritability and sort of acting out behaviors. They sort of take it out, their frustrations outwards, and they act out in ways that are unusual for them. And those are some of the signs that children and teens might be reacting to the stress. The other changes that we might see is decreased in school performance or avoiding school. And I know that most people have moved to sort of the online school, but maybe it is avoiding signing on or doing the work or connecting during the video conferencing. That you see a decrease in their ability to pay attention or concentration, and maybe things that they enjoyed doing in the past, they just have lost interest in. For a lot of kids and teens, the way that they express their upset is through body symptoms and signs, so headaches or body pain. Those can be indications of stress and emotional disruption. And then we also see some uncharacteristic impulsive acts, unusual things that they normally wouldn't do. So what can you do to support your kids and your teens, your family during such time? Is talk about an age level appropriate amount of information about COVID-19. Remember that they are passive absorbers of the news on TV and on the social media that you might be tuned into, and they are going to pick up on those stresses. And one interesting fact came out of 9/11, that when they looked at children who watched the news about the planes that hit the Twin Towers, when you asked children what happened, they reported that thousands of planes crashed into buildings because they were not able to distinguish between the repetitive repeat of that image and it being a unique situation. But did you also know out of that came some research about adults, that while we know that we're watching a repeated event over and over again, our brain actually accumulates those, not to a 1-to-1 ratio, but it does accumulate those events, and it can really forget that every time you watch the news story, it is the same news repetitively stated, but that it actually seems accumulative. With kids or teens, we want to ask questions and share facts that are age appropriate, that they can understand. And there are resources through the World Health Organization that actually are presented and made for children of certain ages and teens of certain ages. So access those. Don't make it up as you go. There's already places that you can go that have the fact sheets available in age appropriate language. Stress in kids and teens usually has to do with their safety. So reassure them that they are safe. Make sure that they understand the risk associated in real terms, but not in necessarily those over-exaggerated terms of either your health, their health, or people dying around them that they care about. Let them know it's okay. Give them permission to be upset. And share with them how you deal with your own stress so they can learn from it. After all, that's what adults in children's lives are for. It's to model the behavior. So if you model the good and healthy coping strategies, they will learn from you and cope better with their own stress. What can we do to help our families get through this? As I said, I can't underestimate exposure to news and social media. Limit it. Set it to once a day, and that children will misinterpret what they hear. So they might be in the background while you're talking on the phone or while you're watching news, but they will pick it up, and it can cause them to be frightened about something that they don't understand. We are creatures of habit. We love routines. And when routines get disrupted, stress levels go up. So if you can establish a new routine with schools being closed, with activities being curtailed or stopped, find a new routine, wake up time, bed times, touch points during the day that become certain, and be that role model and connect with your family and your friends, even if at a distance.
A quick comment, because I do have a teenager who's I think one of his biggest challenges being seeing his other friends out there not following social isolation protocols, and they're out getting to see. And so this was weeks ago, trying to have that conversation about why we're doing what we're doing. So he's now become my biggest advocate, and he's one that tells me when it's time to go to bed, so I'm not staying up too late. So he's taking care of me, making sure I'm getting my sleep. But it's an interesting thing when he gets different reports. So I think having an open opportunity for them to ask whatever questions, no matter how silly or whatever they might be, is finding time for them. So that's definitely probably my biggest strategy, making sure he has the chance to ask the questions he needs to. So
I think also some parents put the responsibility that they have to have the perfect answer for that child, or they have to have the answer, and they're afraid of opening up that conversation. But here's the thing, sometimes what you can do is find the answer together on reputable sites like the World Health Organization, on the CDC, on the government websites, and that you help them find the information even if you don't have it firsthand, and it's not being afraid to not have the answer, but the willingness to find it with them. And most parents, they're afraid of having the conversation because they don't know what to say, or they don't know, just know where to go and get it. Any other questions or comments?
Jeff, even just to touch on even parents at home that are single parents that are looking after kids, like an increased stress and having to like say come to work and deal with that. And even maybe if you could even touch on like even partners who are both in the healthcare field with both dealing with that stress at work. Like I feel like that can even add even a little bit more dynamic into the household.
Yeah, I think that the key is the communication and the openness. And I think that if you are two adults sharing your concerns, you want to make sure that your children may not be witness to it, but what they actually are involved in is the discussion about sort of what's being put in place to help the family cope. And again, as a single parent, you don't want to put that burden onto your child, but you want to reassure them. And despite the fact that you might be fearful, that you might feel stressed, as much as you can, use another adult as your support. Don't use your child, which is, again, common sense. Most people would know that. But talk to them with the plan to get through this together, and make sure that you have the access to supports for the children when you're not there. Do they know who to call? Do they know what's available to them? Even if they don't feel like they want to put that burden on you, and again, depending on the age of the child, do they know where they can call and who to talk to and who their go-to is? So I think it really is just have the conversation, but don't have it in the preliminary stages where you as the adult are trying to figure things out. You need to have the conversation when you have got a plan in place, and it doesn't have to be perfect. And the nice thing about kids is generally they will trust you if to help them get through this. And so don't let your anxiety pass on to your kids. That would be my number one. And if you need help with that, that would be something that I would really encourage, that you reach out to those more formal supports that can help you come up with that plan, come up with that strategy, and involve your child either as a single parent or, again, as two parents working in the same field. Reach out to those contacts and supports to help your family unit through it. So the last section that I want to go through is, as we said before, social isolation and quarantine has shown to have an impact on people's mental health. And sometimes coming out of quarantine can be difficult as well. And being isolated and distanced from other people for an extended period of time has its own unique set of reactions that sometimes people are surprised by. There's a sense of mixed emotion, everything including relief after the quarantine or the isolation is rescinded, to actually an ongoing fear and worry about their health, that it almost feels dangerous that the quarantine is lifted. They've been living with a sort of focus on their health, their fears about their health, their fears about their loved ones. And it does not help when we see in the media that, different places around the world are telling their healthcare workers to make sure their will is up to date and all those different things. It doesn't help to hear those messages. So it can feel equally upsetting to have the lifting and to have those freedoms reinstated, that we go from the sense of being hypervigilant to the signs and symptoms going on in us and being monitored by others and checked in, to suddenly be free to return back to work or level of functioning. And it can create that same sense of danger, fear, anticipation, or dread. So what do we see as being the most common reactions? Well, first of all, when we are in isolation, then maybe we feel anger at maybe the exposure, the source of the exposure, maybe even the mandated isolation. Maybe we feel that sadness because of the disconnection. Maybe what we also do is feel more disconnected because our friends, our family aren't checking in on us. Or maybe we start to resent the fact that they are afraid of us in isolation, those in isolation, because they're afraid of contracting the virus or disease from us. And that we might sense that people are distancing themselves or wanting to stay away because of that exposure. Another aspect that we see is that people feel that when they are having to isolate because of a possible or actual exposure, that they feel like they're letting their team down at work, that they're not able to perform, they're not able to contribute, and that they have this inordinate amount of guilt about that. But also that the quarantine takes them out of those normal parenting duties or shared responsibilities, and that they feel a sense of letting their families down as well. And we start to see all sorts of unpredictable and almost anticipated range of emotional and other mental health changes that I talked about earlier, from that acute stress reaction, anxiety, depression. Like I said, the research later says that 3 years later, we can even see that there's increased risks of development of some of the more formal mental health diagnosis like PTSD. In no way does quarantine, are we saying, guarantees that you're going to go on and have a mental health condition or disorder, but it does increase the likelihood. Well, I want to bring up our last slide and say that if you've watched this video, and again, thank you for the participants from our frontline healthcare workers, Nicole, Eric, and Leanne. If you do feel that after watching this, that you or somebody that you know is in need of more resources, what we would encourage you to do is reach out to the most appropriate and imminent resource based on that person's need. Everything from 911 to somebody who might be a risk to themselves or others. If you have access to your local peer support team, either on site or through your healthcare organization, access them. Through the Alberta Healthcare Health Links line, the suicide and crisis numbers that are available in most communities around Alberta, Canadian Mental Health Association distress line, and Edmonton, and both in Calgary. There's a multitude of resources available, and if you, through your employer, have access to an employee and family assistance program, there should be the availability of receiving both online and telephone support during this time. So seek out those numbers. And as we conclude, are there any last comments or questions that our panel has before we end today's session?
The only thing, well, first of all, thank you for putting this on. I just wanted to reiterate something Nicole said earlier that really, I think, needs to get out to staff, is how amazing they are stepping up to the challenges, like the good stuff that is coming out of this, right? So I think it's really important to be mindful of the hard work and the stress that it's causing, but also, like you said, that there are some things good come out of this, and hopefully we can move forward in some really good programs that come from all this. So.
Yeah, Jeff, just want to reiterate, just thank you for doing this presentation. I think a lot of staff and frontline healthcare workers will find it very helpful and useful in the days and weeks to come.
Thanks.
My turn for my thank you. I think for me, it's been a really good reminder that the principles of stress management in an acute situation, they can be transferable to this crazy pandemic, who knows how long, completely ambiguous situation. And if we can focus on what we know we need in ourselves to be resilient and to cope with stressors, that should be our first checkpoint and our first stop to make sure that we're able to care for ourselves, because as healthcare workers, we are in the position to care for everyone else, and we can't forget to take care of ourselves first.
Absolutely. I want to thank you guys for dedicating your time and agreeing to participate in this. Our very last slide that will come up will be a website and a resource for individuals who might want more information on coping with stress, talking to children and teens, and coping with family. The website belongs to the Alberta Critical Incident Provincial Network, which is a provincial network of public safety personnel and hospital-based teams that come together to support each other, and that it really is a knowledge base and resources for people to access. And so the website address that you see on this slide, it's every information on there, every bit of information belongs in the public domain. Please use it, pass it along, and that you are given permission to share this video as widely and distribute it, post it, Facebook, anywhere that you see fit that our healthcare workers will see it and benefit from it. There is no copyright, there is no control on it. We've done this as an organization to recognize the impact that our healthcare workers, the level of stress and duress that they're going under and have the potential to go under, and that we just wanted to put something together that helps them continue to do what they do, which is helping us civilians through our worst day and through our medical emergencies and difficulties, and keep them safe. We need them in place, and that's what we're committed to.